Hello, welcome to part 4 of Clinical Physiotherapy MCQ series. Let's move to our 16th question. While a 31-year-old patient is walking in the parallel bars, the physiotherapist observed that the pelvis drops down on the side opposite to the stance extremity. This gait deviation is an indication of weakness of the hip. Option A, abductors of the swing extremity. Option B, adductors of the swing extremity. Option C, abductors of the stance extremity. Option D, adductors of the stance extremity. And the answer is Option C, abductors of the stance extremity. Explanation of this question is abductors are particularly active during the mid-stance phase of the gait to prevent the contralateral pelvis from excessive lateral tilting. Weakness of the hip abductors, particularly the gluteus medius, causes the hip to drop down on the side opposite to the weakness. For example, weakness in the right gluteus medius show up during the stance phase of the right by excessive downward movement of the left pelvis. The hip adductors are active during the terminal stance and through midswing would not play a role in controlling the lateral rotation of the pelvis. The hip abductor shows the little activity during swing phase. Now let's move to our 17th question. When treating a 44-year-old patient who has ankylosing spondylitis, the muscles requiring the most emphasis for strengthening the exercise are the Option A, pectorals. Option B, hip flexors. Option C, back extensors. Option D, abdominals. And the answer is Option C, back extensors. Explanation of this question is trunk range of motion exercises and strengthening to minimize the thoracic kyphosis are essential. Persons with ankylosing spondylitis tend to assume flexed postures. Disproportionately strong pectorals, hip flexors or abdominals could worsen the kyphosis. Now let's move to our 18th question. You are treating an 18-year-old male patient for rotator cuff tendonitis. The physician suspects the patient actually has dislocated shoulder. Which of the following would you not expect to find when treating the patient for shoulder dislocation? Option A, the head of the humerus can be easily palpated. Option B, there is localized pain in the shoulder. Option C, there is crepitus in the joint. Option D, the patient is holding the shoulder in flexed position. And the answer is Option C, there is crepitus in the joint. Explanation to this question is you would not expect to find crepitus in acute shoulder dislocation. This is because crepitus is a sign of chronic condition that typically would not be found in an 18-year-old male. Moving to our 19th question. A 3-month-old child has motor and sensory loss in the right upper extremity in the areas innervated by C5, C6 spinal nerves. The cause of this birth injury most likely is Option A, hemiparesis. Option B, Ebbs-Duchenne paralysis. Option C, spinal cord injury. Option D, Klumbicki palsy. And the answer is Option B, Ebbs-Duchenne paralysis. Explanation to this question is a brachial plexus injury that affects the C5 and C6 nerve roots is termed as Ebbs-Duchenne palsy. A lesion affecting C8 and T1 root is termed Klumbicki palsy. Hemiplegia and spinal cord injuries would be caused by trauma to central nervous system and would not normally affect just C5 and C6 nerve roots. Moving to our 20th question. A 27-year-old patient has a history of neck pain that is aggravated by the long period of sitting. The pain becomes progressively worse by evening. Range of motion and strength of neck and shoulders are within the normal limits. Sensation and reflexes are intact in both upper extremities. The patient has forward head and excessive thoracic kyphosis. The most appropriate exercise program includes Option A, stretching of the neck flexors and pectoral strengthening. Option B, upper trapezius strengthening and pectoral stretching. Option C, pectoral strengthening and rhomboid stretching. Option D, rhomboid strengthening and axial neck extension. And the answer is Option D, rhomboid strengthening and axial neck extension. Explanation to this question is History suggests that the prolonged improper positioning of the cervical spine resulted in neck pain. A chronic forward head and kyphosis result in hyperextension in the upper cervical spine and excessive flexion in the upper thoracic spine. Further muscle length appreciation occurs in the tight anterior muscles and stretched posterior muscles. Treatment should include correction of the muscle weakness or imbalance. Rhomboid strengthening and axial neck extension are the only options that are both correct. That's all for today. If you need further clarification, check the description box and give your feedback in the comment box. If you like this MCQ session, do subscribe to this channel for more videos. Thank you.